Post-Surgery Rehab CABG by Katrina Griffith. What is a CABG? CABG is an acronym for coronary artery bypass grafting. What is a surgery? CABG is a procedure used to treat coronary artery disease. Coronary artery disease, or known as CAD, is a narrowing of coronary arteries, the blood vessels that supply oxygen and nutrients to the heart muscle. CAD is caused by a buildup of fatty material within the walls of the arteries and narrowing the insides of the arteries, limiting the supply of oxygen-rich blood to the heart muscle. Here is what it looks like without plaque buildup and then with plaque buildup. Symptoms and how it affects you. Symptoms. If you have coronary artery disease, your symptoms could be caused with chest pain, fatigue, palpitations, abnormal heart rhythms, shortness of breath, swelling in the hands and feet, and indigestion. There is usually no symptoms in early CAD, yet the disease will continue to progress until there's enough artery blockage to cause symptoms and problems. If nothing is done, the blood supply to your heart muscle continues to decrease as a result of increasing blockage of coronary artery. You may have a heart attack. If the blood flow can't be restored to the particular area of the heart muscle affected, the tissue dies. How is the surgery performed? The surgery. The doctors usually bypass the blocked portion of the coronary artery with a piece of a healthy blood vessel from elsewhere in your body. Blood vessels or grafts used for the bypass procedure may be pieces of a vein from your leg or an artery in your chest. Then the doctor attaches one end of the graft above the blockage and one on the other below the blockage. Blood bypasses the blockage by going through the new graft to reach the heart muscle. How it is performed. The doctor makes a large incision in the chest and temporarily stops the heart. To open the chest, your doctor cuts the breastbone sternum in half lengthwise and spreads it apart. Then the doctor inserts the tube into the heart so that the blood can be pumped through the body by a heart-lung bypass machine. The bypass machine is necessary to pump the blood while the heart is stopped. And then your doctor is going to place the graft and then reverse everything he did in the beginning. So here is coronary artery bypass surgery. So before, you can see there's a lack of oxygen, and then after they open it back up, it's all okay again. Why rehab for the surgery is needed. Directly after the surgery, the patient will start in the recovery in an intensive care unit. Then the patient will stay in the ICU for 1 to 2 days so your healthcare team can closely keep track of your condition and vitals, and then most patients stay in the step-down unit for 3 to 5 days. Phase 1 of the clinical phase. So this is for the rehab, and it begins by assessing the patient's physical ability and motivation to tolerate rehabilitation. This goes through non-strenuous exercises in the bed or at bedside, focusing on range of motion and limiting hospital deconditioning. And then this focuses on activities of daily living and educate the patient on avoiding stress. And after that, the rehabilitation team assesses the patient needs such as assistive devices, patient and family education, as well as discharge planning. And then phase 2 is going to be outpatient cardiac rehab, which lasts 3 to 6 weeks. And the information and /advice tailored training program and relaxation program is specifically for you. And then the treatment phase intends to promote independence and healthy and lifestyle changes to prepare patients to return home to their lives at home. And then phase 3 is going to be post-cardiac rehab maintenance, and it's going to involve more independence and self-monitoring. And then it centers on increasing flexibility, strengthening, and aerobic conditioning. So here is him biking on elliptical, which you will probably do if you have to go through rehab of a CABG. So the rehab steps: warm-up, main exercise, and cool down. For the warm-up, before you start it, you are going to take your vitals, and then after the cool down, you are also going to take your vitals just to see how it changes. And the warm-up is going to redistribute blood to active tissues. This is going to increase muscle temperature and speed of muscle action and relaxation. It prepares the mind and prepares the muscles for a range of motion involved for the conditioning period. And then this includes pulse raising activities around 5 minutes and marching on the spot, walking, low level cycle, following by stretching of the major muscle groups, which is also another 5 minutes, followed by more pulse raising activity. So some stretches you might do within this is calf stretching, lower back and hamstring stretching, thigh stretching, and Achilles stretch are just the lower body stretches. And then for the main workout, you're going to do about 10 to 15 reps to moderate fatigue of 8 to 10 exercises. So then this is going to be separate stations are set out, and participants spend a fixed amount of time at each station, around 30 seconds to 2 minutes. And then before moving on to the next station, there may be a rest or active recovery in the form of resistant work targeted at specific muscle groups. And then this also varies for each patient, the duration spent at each station, and the intensity. They usually end up increasing the resistance, speed, or range of motion throughout the program, and then the period of rest will probably diminish during the overall class. And then for the cool down, it's around 10 minutes, and they just want to bring the body back to its resting state, so it should incorporate movements of diminishing intensity and passive stretching of the major muscle groups. This is necessary because this leaves an increased risk of hypotension if you don't do this. Older hearts can take longer to return to resting levels, so this kind of helps it out. And then this is raised sympathetic activity during exercise increases the risk of arrhythmias immediately post-exercise, so the cool down will help the doctors monitor this and just make sure they are all okay. And then some exercise within the rehab steps, you are probably going to do a lot of walking, bicycling, possibly some swimming, rowing, and jogging. Jogging would be in the last week or so of the rehab steps or even longer. And then cross-country skiing and resistance training. So all of this is not going to be very hard in the beginning, and then it's going to continuously get harder out the end just to make sure you're healthier than when you came. And then why is this important? Because around 500,000 CABG surgeries are done each year, and this affects people mainly with the age of 58 through 71 or 74. And then this is 70% of each CABG patient lived 10 years or more after the CABG surgery, so it does have a high success rate and high living rate after your surgery. And that is my presentation. Thank you. If you have any questions, you can reach out to me through SportsMed. Have a great day.